Okay. I would like to thank Professor Sayegh for the honorary invitation and his wish to present this lecture about my PhD thesis. Special thanks to Professor Kapetanos that gave me the opportunity to begin and finish this study, and a special thanks to you all that stayed so late tonight to hear about basic science, because it is basic, first of all, but rather dull. I hope I fulfill your expectations. I'd like to dedicate this lecture to the memory of my supervising professor that was passed away last year, Professor Ioannis Kirkos. And I think that we all know him. Orthopedic implants. What are the orthopedic implants? Synthetic or natural materials that are used in vivo to substitute or to enhance muscular function. We all know their use in fracture osteosynthesis, in osteotomies, in arthrodesis, in total joint replacements, in dental implants, and also in amputations as orthotics. Orthopedic implants are designed to be biocompatible, resistant to corrosion and degradation, and to sustain specific mechanical and wear properties. And they are made of a lot of different materials, such as stainless steel, metal alloys, titanium alloys, polyethylene, silicone, ceramics, etc. What is osseointegration? The term was first described by Brannemark back in 1977 and was defined as a direct bone-to-metal interface without interposition of non-bone tissue. And reflects an anchorage mechanism, whereas a biomechanically oriented definition is a process whereby clinical asymptomatic rigid fixation of alloplastic material is achieved and maintained in bone during functional loading. The implant tissue interface is an extremely dynamic region of interaction. This complex interaction involves not only biomaterial and biocompatibility issues, but also alteration of mechanical environment. The processes of osseointegration involve an initial interlocking between alveolar bone and the implant body, and later biological fixation through continuous bone apposition and remodeling toward the implant. This process itself is quite complex, and there are many factors that influence the formation and maintenance of bone at the implant surface. The successful outcome of any implant procedure is mainly dependent on the relationship of the various components of an equation that includes the following: biocompatibility of the implant material, macroscopic and microscopic nature of the implant surface and design, the status of the implant bed in both health and morphological context, the surgical technique, the undisturbed healing phase, and loading conditions. The challenge for a physician is that these several factors must be controlled almost simultaneously. Direct bone healing, as it occurs in defects, primary fracture healing, and osseointegration, is activated by any lesion of the pre-existing bone matrix. When the matrix is exposed to extracellular fluid, non-collagenous proteins and growth factors are set free and activate bone repair. Once activated, osseointegration follows a common biologically determined program that is subdivided in 3 stages: incorporation by woven bone, adaptation of bone mass to load, and adaptation of bone structure to load, the bone remodeling. Excuse me. In addition to the differentiated bone cells like osteoclasts and osteocytes, bone and adjacent tissues contain a number of less differentiated cells, the mesenchymal cells. These undifferentiated cells are of utmost importance for proper bone healing or anchorage of an implant, since they can be recruited to form osteoprogenitor cells. In osseointegration, the bone potential for callus formation and remodeling has the leading role, so the factors influencing this procedure are similar to fracture healing. Any disturbance in this procedure leads to inadequate osseointegration and insufficient implant anchorage, with final result, the implant loosening. Despite the research that has so far carried out, the loosening of implants is a particularly serious problem because of the increased morbidity and the increased costs. The free radicals. The damaging effect of free radicals on cells and tissues has been a subject of intense research. The scientific interest has been focused on free radicals because of their implication in a plethora of pathological conditions and diseases. Despite the intensive research which provides an increasing number of incriminating evidence, the role of free radicals in the pathogenesis of different diseases, and mainly in loosening of orthopedic implants, remains elusive. This imposes the necessity for a thorough understanding of the mechanisms employed by different organisms in order to cope with oxidative stress. Thus, an intervention that facilitates the maintenance of the oxidative status will be feasible. That's the idea of the whole research. Oxidative stress reflects an imbalance between reactive oxygen species, known as ROS, production and the potential of a biological system to inactivate these toxic molecules and to repair any damage from them. Antioxidants are low molecular weight molecules or substances that eliminate free radicals or disrupt a free radical chain reaction. These are consumed during the interaction with ROS. Therefore, their antioxidant potency is directly proportional to their concentration. Okay. Natural antioxidants protect the cells against the damaging effect of free radicals. Dietary administration of antioxidants such as alpha-tocopherol, that is a vitamin E isomer, protect organisms against the damaging effect of the free radicals. As it is evident in the literature, administration of alpha-tocopherol has a positive impact in cells during fracture healing due to activation of bone metabolism. Moreover, alpha-tocopherol positively influences bone quality. Biological events that take place at the bone-implant interface include the activation of those genetic processes similar to those of bone healing process. The effects of vitamin E on osseointegration are currently unknown. This is our experimental design and protocol based on the ideas I gave you so far. 30 adult male Wistar rats were used in this study, and the animals were divided in two groups, 15 each one. A specially designed stainless steel screw was surgically implanted in the proximal metaphysis of both tibiae of all animals, as we see in these photos from the lab. These two photos are the specimens after the removal of the soft tissue and X-rays of the animals. Alpha-tocopherol was administered daily to all animals intraperitoneally to the treatment group for a period of 4 weeks, 28 days. The control group received normal saline instead. On day 29, the samples were collected to determine, blood samples, alpha-tocopherol concentration and the oxidative stress biomechanical parameters like malondialdehyde, MDA, the reduced glutathione and oxidized glutathione ratio, protein carbonyls, catalase, and total antioxidant capacity. After that, after picking the blood samples, the tibias were tested for the pull-out strength of the screw pull-out strength, by the use of a customized experimental device. These are two videos from the experimental device and the procedure of the pull-out, the test. Also, the torque of the screw was determined by the same device. And these are two videos from the torque test. Finally, the samples were sent to histomorphometric analysis. Hematoxylin, eosin, and Mason trichrome stained sections were photographed, and several bone areas in each animal were analyzed. The following parameters estimated: percentage of newborn mineralized bone per tissue area, thickness of the newborn in micrometers, volume of newborn bone in cubic millimeters, percentage of mineralized bone to newborn tissue, percentage of newborn mineralized end osteoid per tissue area, and finally, percentage of bone marrow per tissue area. These are the results. We didn't have any results from the different results as far as the body weight is concerned to the two groups. We have significant differences in every oxidative test. The total antioxidant capacity, of course, the alpha tocopherol was higher in the treatment group, the protein carbonyls, the MDA, the ratio, and the catalase. The biomechanical results were astonishing. We have a great, significant difference between the two groups for the pull-out strength and the torque strength also. Finally, the histomorphometric results, as we can see, to the different scales, percentage of the newborn mineralized bone per tissue area in favor of the treatment group, the thickness in micrometers of the newborn bone, here, the percentage of mineralized bone to newborn bone tissue, here, and percentage of newborn bone tissue at bone marrow per optical field, here. These are photos of hematoxylin and eosin staining. We can see the astonishing difference between the no treatment and the treatment group. And finally, the trichromatic Mason staining, where in green is colored the mineralized, the mature bone, as we can see here, and the osteoid, the immature bone, is red-pink. And this is a compare between the two specimens. The white is lipospheres, the empty spaces. The potential mechanisms that mediate the beneficial effect of alpha-tocopherol on bones can be summarized being one of the most potent lipophilic antioxidants. It reduces substantially the oxidative stress that is induced by surgical trauma. It inhibits the production of pro-inflammatory molecules, and this property renders alpha-tocopherol as a potent anti-inflammatory agent. There are experimental findings in the literature which imply that vitamin E may have an anabolic effect on bone quality by promoting bone formation, improving static and dynamic bone histomorphometric parameters, and improving the bone structural and biomechanical properties. As conclusions, vitamin E, and especially its isomer alpha-tocopherol, is a potent antioxidant, as it is evident by the oxidative stress parameters that were determined in our blood tests. Alpha-tocopherol administration led to efficacious stainless steel implants osseointegration, as proved by our biomechanical and histomorphometric tests. Our findings give the incentive to proceed with future clinical studies that will elucidate the beneficial effect of vitamin E in human subjects. I want to thank all these institutions and laboratories that help to this project to be carried out. And as Vice President of Orthopaedic Association of Macedonia and Thrace, I would like to invite you all next month to our annual Congress. Thank you for your patience. Thank you all.